Okay, so tell me a little bit about Therapeutic Therapeutic Writing Center and how it got started.
Of course. And I'm Paula del Giudice, and I'm the executive director at Little Bit. And Little Bit Therapeutic Writing Center provides equine assisted services for people with disabilities. We got started almost 47 years ago in Woodinville by a woman who had multiple sclerosis, and she felt like riding her personal horse helped reduce her symptoms of multiple sclerosis. So that's basically how we got started. The first horse in the program's name was Little Bit, and that's where we got our name.
That's cool. So, like, what kinds of services do you provide for people with disabilities at Little Bit?
We provide a couple main programs and then a couple smaller ones. So our major programs are our therapeutic horseback riding, riding with a physical therapist, occupational therapist, or speech and language pathologist, and our adaptive riding program. So our therapy program is when a patient comes in, it's a medical treatment, working with as I mentioned, our physical therapist, occupational therapist, or speech and language pathologist. And they are working on functional outcomes for each patient based on the goals that the therapist has for them, much like in any other kind of therapy program. Then our adaptive riding program is more about learning horseback riding skills for people with disabilities. So in terms of the therapy program, the benefits that they're working on trying to achieve are physical benefits and psychosocial benefits. So the physical benefits of riding on the horse are improved coordination, normalization of muscle tone, balance, postural control, strength, increased range of motion, relaxation, activation of muscles, body awareness, visual perception. And in terms of psychosocial benefits, those include self-confidence, self-esteem, a sense of mastery and control of surroundings, attention span, spatial awareness, concentration, things like listening skills and verbal skills, increasing motivation and risk-taking. And as I mentioned, the adaptive riding program is about learning horseback riding skills while gaining that therapeutic benefit. And what the horse is so important is because the movement of the horse provides a three-dimensional pattern similar to when a human is walking. It provides that same action of the human pelvis during normal upright movement when an individual is walking. So the movement on horseback offers improved potential for hip development, walking, among other benefits, core strength, all of those. The horse will take 1,500 to 2,500 steps during a 30-minute session, and that leads to a significant higher number of repetitions that can be achieved in than can be achieved in a clinical setting alone. So many of our patients and riders have other therapies that they participate in, but this one is very effective in helping them gain those functional outcomes that are desired.
Mm-hmm. If you could just explain, like, what kind of impact does horseback riding have on people with disabilities? Like, in other words, like, what effect does that have in terms of like riding a horse for people with disabilities? I know that you touched on that briefly, so if you could explain that.
Well, there are a couple different things. Not only just that, the physical and the psychosocial benefits, but there are other things that happen. Like for a lot of young people being on with disabilities, they are often like low to the ground, looking up at the world. And when you're on a horse, it's a position of power because you're up in a higher position, and it helps breathe. It helps them have more self-confidence, more awareness. There's that incredible bond with the horse that humans have, those bonds with animals, and the bonds with the horse are really important. And so that really helps engage the riders and patients and helps them want to continue to do that kind of work. In addition to the two programs I mentioned, we also have two other smaller programs. One's called Equine Assisted Learning, and that's when groups in the community come out to work with us and our horses with one of our equine assistants or equine specialists, which is one of our instructors. And that is more of an educational model, so helping people learn about leadership development or other things, and using the horses as a part of that kind of learning. And then we also have equine facilitated psychotherapy, which is when individuals or mental health professionals in the community bring their patients or clients out a little bit to work with our horses and with our equine specialists. And that's a mental health model where horses are very good at mirroring human emotions and experiences. So we call them like giant biofeedback machines, that they oftentimes will give a therapist glimpses into what's going on with their patient or client that the individual can mask. So those are some of the other programs that we have.
Lastly, like how can horseback riding, make a difference in people's lives, like just like generally speaking, if you could talk about that.
So that rhythmic movement of the horse, that for some people it wakes their system up, for others it calms it down. And that movement and the closeness with the horse and just, that relaxation, but at the same time building muscles is really an important part of working with the horses.
Yeah, I know I didn't write this down, but like what impact does horseback riding have on the greater community?
So we've not only do we have our riders and patients, and we have over 500 individuals come to Little Bit every year, but we also have hundreds of volunteers who have participate with us every year, and of course our awesome staff. So all of those people together get to learn more and experience what it's like to have that empathy for people with disabilities, and to work with the horses to make something very special happen for our riders and our patients. And since we've been around for 47 years, many people in the community have been positively benefited and affected by the work that we do, not only from the riders and patients side, but also from the volunteers, the community supporters, our funders. All of that works together in a large way to make what we do really successful and important.
Yeah, that's awesome.